Welcome to another episode of MedMadness, where we delve into critical topics in medicine to help you prepare effectively for your exams and clinical practice. In today's episode, we will be discussing the challenging issue of substance use and its association with aggression, particularly in the emergency department setting. Managing a patient with substance use-related aggression requires careful attention to both verbal and non-verbal cues, as well as a strategic approach to ensure the safety of both the patient and the healthcare staff. This is a situation that can escalate quickly, so it's crucial to be prepared with the right techniques and protocols. Next, let's discuss the key signs of escalating aggression in such patients. Substance use, particularly with stimulants or alcohol, can often lead to heightened aggression and agitation. Patients may present with signs such as an irritable demeanor, loud speech, cursing, clenched fists, tense posture, and pacing. These are all red flags that indicate the potential for violent behavior if the situation is not handled appropriately. When a patient begins to show these signs, it's vital for the emergency department staff to act quickly and efficiently to de-escalate the situation. Here are some best practices. First, ensure safety. Before engaging with the patient, make sure the environment is safe. Remove any objects that could be used as weapons. Keep the door open to provide an easy escape route for staff if necessary. Arrange the seating so that the healthcare provider is closest to the exit. Next, engage non-confrontationally. Listen to the patient's concerns attentively. It's important to acknowledge their feelings and needs without being confrontational. Avoid using language that could be perceived as condescending, such as telling the patient to calm down, as this could exacerbate their agitation. Finally, prepare for emergency. Have security personnel nearby, ready to intervene if the situation escalates. Use a panic button or a code word to discreetly alert security if needed. Let me share a brief real-life scenario to illustrate these points. A 45-year-old male patient who had a history of alcohol use arrived at the emergency department visibly agitated. He was irritable, pacing, and clenching his fists while loudly complaining about the treatment he had received earlier. The staff, recognizing the signs of potential violence, took immediate steps to ensure safety. The seating was arranged so that the physician was closest to the door and security personnel were discreetly positioned nearby. The physician listened to the patient's concerns calmly without making any confrontational statements. This approach helped de-escalate the situation, and the patient eventually calmed down without the need for restraints. Now, let's conclude with a summary of what we've covered. In summary, handling substance use-related aggression in the emergency department requires a combination of vigilance, preparation, and non-confrontational communication. Always prioritize safety, be aware of the warning signs, and have a clear plan in place for managing escalating situations. Thank you for tuning in to this episode of MedMadness. Don't forget to engage with the pre- and post-podcast quizzes to test your understanding of this critical topic. Also, make sure to review the Anki flashcards for a quick recap of the key points we discussed today. Stay prepared, stay safe, and keep learning.